You are listening to the podcast To Be Single or Not to Be by Shanna Montana, a podcast where we talk about the single life, dating, and relationships so you can make a decision at the end of each episode to be single or not to be. Okay, so ladies, what is the correct definition of anxiety?
So, anxiety can be viewed as intense, excessive, or persistent worry and fear about your everyday situation. It can include fast heart rate, rapid breathing, sweating, and feeling tired may be symptoms that occur.
Okay, so that is like the textbook definition. Do you have anything to add to that, Casanora, or?
All of that. I think the emphasis on like what she said about persistent.
Okay.
Because that typically manifests as an impairment in some major area of your life. So academically, socially, professionally, personally. And that's where you get into clinical anxiety.
Okay. So what is the difference in anxiety and anxiousness? And I ask that because I've had conversations with people that were like myself, not educated on this information. And they told me that, when you get anxious about something, that's anxiety. And I, didn't know if that was true or not. So what's the difference between anxiety and just being anxious?
We all experience anxious moments. Those are not always indicators of anxiety. So most people, when they have a job interview or a first date or something like that, you get anxious. But if those feelings subside in a relatively short amount of time, a few minutes, an hour, a couple of days, that's not typically anxiety. Anxiety is, like she said, persistent, and it's causing impairment in other areas. A lot of times anxiety can be indicative of concerns that are not necessarily related to something rational. So a fear of something that is not present, has not happened, may not ever happen, as opposed to, I really want this job and I want to do well and I'm nervous about performing well. But after the interview's over, you're like, okay,
now I can breathe.
Down. Yeah. Whew. I
Okay.
can breathe. So that's feeling anxious. It's not an anxiety disorder.
Makes sense.
It's something that continuously interferes with like your day-to-day functioning.
Okay.
Or your ability to like push through certain tasks or just your day-to-day function. It's some type of interference that continuously happens.
Okay. I'm learning. I need to know this stuff because I am a person that if I do have anxiety, I don't own it right now, but I think my lack of ownership comes from my lack of education. So that is why I'm here today, other than this being my podcast. So is anxiety a normal part of life occasionally for everyone? Because I know you all told us the difference with anxiety. It's more like it's a persistent and consistent condition that keeps coming up and it interferes with your daily life. So is that normal for our life, like every day, for everyone?
I would say so. My personal opinion, I think everyone has a certain level of mental health. We all have depression. We all have anxiety. We all get stressed. We all have mood swings. So some people adapt and, can what's the word? Can move through whatever their emotions and feelings are or balance it in a way. But we all get anxious. We all get anxiety. Some people handle it better than others. Some people, have difficulty handling it or, that's when it may move to an everyday interference with your daily operations. And at that point, it becomes a diagnosis.
Right.
To where you may need help in helping you to manage the symptoms.
Okay. And we're definitely going to talk about the symptoms and coping with it and things of that nature. So do you feel like when it comes to anxiety that everybody should have a little bit of education on what it is for purposes of if they have it, if a partner has it, if a kid has it, should everybody have a little bit of education on it?
Yes.
Okay. And
yes.
Where do they start? Other than here with this podcast.
Right. So one thing I will say first and foremost, you cannot diagnose yourself, and unless you are clinically trained and you are providing clinical services to someone, you cannot diagnose other people.
Okay.
And so even if you are a clinician, with us having a personal relationship, I am not equipped to diagnose you with any sort of mental illness if I am not operating in the capacity of your therapist.
Okay.
So you can get some information from Google. Google is your friend. How the and ever. don't get on WebMD, because WebMD gonna tell you that you got major depression, generalized anxiety disorder, PTSD, voice to men, ABC, BBD, all of the things, and you don't have the understanding of how the DSM works, which is the manual that we use to diagnose individuals or to assess if they have criteria for a diagnosis. So I will say, go to workshops. You can do some webinars. You can do some Googling, but don't then try to diagnose yourself
or the people around you. Okay.
So yeah.
Would you agree with that?
I would, absolutely. I think knowing your triggers, and sometimes we don't recognize that we have symptom triggers, but if you are becoming like extremely tired, if you feel like a difference, in your heart rate, or you're like pacing really fast, or you just don't feel your normal self. Those are like signs.
Some of the signs.
Mm-hmm,
and that's what I was going to go into. I was going to say, what are some of the signs of like different ways where anxieties can like show up in your life? Like, how do you identify it to know that this is happening to me? Beyond, like that's normal. I feel sometimes the nervousness of an interview or a first date or something. So beyond that, and those are things like you said you come down from. How do you identify it beyond that to know when it's happening? If it's a certain trigger or if it's a certain thing that may be said or a certain environment, like how do you figure out the difference between this may be anxiety or I just may be a little nervous or this is something completely different?
I think it's about just kind of knowing what your baseline is. Like, even if you don't understand clinical diagnoses, you know your baseline.
And explain to people what a baseline is.
It's just kind of your everyday. So, like, on a general day, I'm a fairly kind of go with the flow person. Mm-hmm. So, not saying things don't bother me, but certain things don't bother me. Like, I don't get bothered by Nashville traffic because I live in Nashville and I expect every day I'm going to be sitting in my car somewhere between 35 and 60 minutes, and that's just kind of part of my life.
Right.
But if you start to notice that things that maybe didn't bother you before are starting to bother you now, if you notice that you're getting tired, if you notice that you're more irritable, if you notice that you are externalizing emotions more often than you have previously, so maybe you're crying more, or maybe you feel more angry often than you would be before, just get that checked out. Like, if you notice differences, that's the easiest way for people who maybe don't fully understand their own mental health or just mental health in general. When you start to see things different about yourself that have not been there before, go talk to a professional and get that worked out. And if you are employed like full time and your job offers like health benefits, a lot of places now have employee assistance programs, EAPs.
And we're definitely going to get into that. So
okay.
Hold tight. We're going to get there.
Look. I'm sorry. I got excited.
So yeah. So what do you think as far as other things how you identify triggers?
I agree. I do think that there are situations and people that don't know that they may have anxiety. Example would be OCD. A lot of people say, I'm just OCD.
I learned to stop saying that because I realized I'm not OCD.
You may or may not be.
I've diagnosed myself as not being it.
She just said don't do it.
Yeah, you just said don't do it.
So you diagnosed yourself
I'm about to take it back. Because I had diagnosed myself as OCD, and then in my research of this episode and talking to different people, I think my sister, she was like, Shayna, and she's not a clinician either. She was like, you're not OCD. She was like, you just like things to be a certain way. But I'll tell this experience when I was really younger and we were at my mom's house. There was this rug that would be in the living room. And if that rug, the tip of that rug got flipped over when somebody walked past, I had to flip it back. It would be to the point that like my brothers would go and flip it over just to see me go back and put the rug down. And they would do this like 20 times a day. Why did my mom let them do this to me? But they did it. And so we were like, that was OCD. We felt, being that we aren't clinicians,
and
but
now.
People,
those could be triggers for some people. If you get into this obsessive behavior where it has to be this way or it has to be done, or you get irritable or it's messing up like your day-to-day functioning, or, if you offer your rockers, if something... those are like, little red flags. Not to say that you have the diagnosis, but
things to pay attention to.
Yeah, absolutely.
Okay, absolutely.
Yeah.
And I no longer have that condition where if the rug is flipped over, I have to go and, move it back. Just want to let people know. Yeah, I overcame that.
That falls in the anxiety family.
Yeah, it probably
it's
would.
Something that, keeps you anxious in a sense.
Yeah, absolutely. It makes sense. So what does it feel like, we kind of talked about mentally how you may change or certain things may trigger you to think a certain way or certain things make you angry. does any physical feeling come with it? You know, do you kind of like tingle on the inside? Do you find yourself shaking or nervous? You know, what physical things may come along with anxiety that can help you to identify that it's happening?
Well, like for me, when I was, let me scoot up. Like for me, when I was working on my dissertation, I was politely referred to the student counseling center because I had really severe headaches and I was nauseous all the time.
Okay.
And I'm okay. It's just, I think what do you call that, a baseline? Mm-hmm. I think that my tolerance for increased during that time.
But your baseline increased?
Yeah, it seems that way. But my advisor said, "Oh, honey, that's cute. Come on. We're going to go to the manor." So she politely walked me over. And then I spent my last 2 years working that out with
a counselor or a therapist.
With a counselor.
Because so what was it for you? Like, what were the things that were happening that made her recognize?
I would have headaches all the time.
Mm-hmm.
And I mean, it gets to the point where I feel like I should have bought stock in a certain medicine. And then I was constantly drinking ginger ale.
Okay.
So it was just kind of like, she was like,
yeah.
She said, "Mija, we're going to politely walk ourselves over."
Because you had evaluated that, I think with the stress of what you were going through, your baseline might have been, say, at number 4. If you had raised it to number 7 to say that this is normal, not recognizing that it was something more before you went to get the help.
I think it was just okay, I got to push through this so I can get this done.
Yeah. And sometimes we do that.
And not realizing it was to the detriment of myself.
Absolutely. So I'm glad you were able to get help. Are there any other things that you all think about that may physically happen to a person to know that this is anxiety or could be?
Yes. So I do want to speak to what you were talking about, because what I've noticed with a lot of the students that I work with, because I work at an elite institution, is what I've called high functioning anxiety and also high functioning depression. And so there is an image that the media gives us of anxiety, and that is how some anxiety manifests for some people. For some people it is panic attacks. For some people it is night sweats. For some people it is constant headaches. But for some people it's when I'm in front of others, the reports are perfect, the presentations are spot on, I'm performing well on my test, and then I get back to my room and I can't focus on anything and I have to sleep and I'm up all night because I'm so keyed up. But nobody sees it. So you're able to keep getting things done. And so others around you may not see that. You are contending with these very internal issues, but you may still be experiencing what I call high functioning anxiety.
Because you're still, for all appearances' sake, you look to be okay.
You look fine.
Absolutely. And I've met people that were diagnosed with some, I don't know if they called it high functioning depression, but it was like they still went through their everyday life. They went to work, they hung out with friends, they took care of their family. But I would say, I guess in the privacy of at night when they went to sleep or when they were by themselves, they were depressed. And it's something that I think more people than not might go through. But because we all feel like naturally, in my opinion, have to keep up appearances, have to look a certain way, I think that at this point, the shame is being taken away, I believe, from anxiety and depression because people are talking about it more. And that's just for me looking at it from a worldly view. And I think that that's helping people to talk about it. But previously, people didn't, because who wants to show up and say like, "Hey girl, I'm depressed." And then you might run, how does that go? And then, or you run the risk of telling somebody and them judging you, or telling somebody and, it just having a negative effect, because depression is not a positive thing. So I can see how you would be afraid to talk to somebody about it, and then not knowing that, say, therapy is an option, or the EAP, like we're going to talk about a little bit later, is an option to help you work through it. So I think it's really important for people to recognize that you may still be a very, as Casanova said, high functioning person. But if you are exhibiting some of the symptoms, things that we've talked about mentally, physically, emotionally, it may be something worth looking into to see if you may have a diagnosis there. Now tell me, can anxiety be hereditary?
I don't know. I guess that depends on the perspective of the person, maybe how they grew up. Like if you always, seen mama stressing and you took on that learned behavior, and it kind of trickled onto you. I mean, you can say hereditary in that way, but it's not like in the bloodstream.
But it can be, I would say, so maybe it can be, to some degree, a learned behavior.
It could be a learned behavior.
If you're looking at what mom...
We all have those levels of, you know, just a born mental health traits, but it depends on, like, the psychological realm of, like, that person's life and their perception, maybe, you know, how they perceive things. So if you perceive mom was, you know, a busybody or was always, you know, on the move, then, you know, she may grow up having those same personality traits, and she might carry on that same, you know,
anxiety if it was diagnosed as that. So is that something that in the Black community, do you all feel that anxiety is more prevalent than any other one in you all's experience?
So what I will tell you is that I work with all kinds of students, and Black students who come into my office, I have seen just as many students who are struggling with anxiety as those who are struggling with depression.
Okay.
But I do think it's very important that if you are going to see a clinician, that you have someone who has some cultural competence or cultural awareness. It does not necessarily have to be a Black person.
Okay.
But I do recognize that Black people sometimes feel like it's a safer bet to go to a Black clinician, and I get it. It's part of the reason I became a clinician.
Why is that a safer bet to go to somebody that looks like you?
Well, girl, that's a whole other conversation.
Let's tap into it a little bit.
Just a little bit. Okay, so historically, mental health has been a white male-dominated field.
Okay.
And so Black people did not feel comfortable talking to white folks about our issues. One, because if you're thinking about in the 60s and stuff, which is when my mother was born, these people did not understand us. They did not consider our spiritual lives into the things that were going on with us. And it wasn't safe to share that with a white person. And even though there are more women and folks of color who are in mental health now, it is still white male dominated. So your leadership is still primarily white men. And so it just wasn't safe for Black people in general, particularly Black women, to share what our concerns were with these folks. And there's always been this wealth gap in this country, and up until about 2 decades ago, mental health was not covered by your insurance. So you could only really get these services if you had the money to do it. Right. And so what Black people did as a way to cope is, because we couldn't have access to this thing anyway, we othered it. And so, that's not for us. We don't need therapy. We go to church. Well, the reality is church was all we had. And it was our only resource, and we clung to it because there was no way we were going to be able to access this mental health resource, most of us anyway, because of the wealth disparity. But I think that's part of why Black people feel safer with a Black person, just because I think you probably gonna understand me and where I come from and my history and why things are impacting me. I think all Black people on some insular level have anxiety, and I think it's because of the stuff that we see in society. I think we are triggered by so many things. I think we are inundated with so much trauma that is reflective of our identity. And so I think everybody should go to therapy, but I especially think Black people should go to therapy, because I don't think any of us don't have something that's going on just because of how society views us and the microaggressions that we experience and the things that are going on in a broader context.
Absolutely. I love it, everything you said in regards to that. And I want to know, why do you feel, I know you made a really great point, because we see a lot of times, I'll just say on social media, like, church and your pastor, they are not your therapist, this, that, and the third. So in the point that you just made about, we didn't have access to those resources like white middle America did. So why do you feel like now, other than, I would say, maybe financially, why is it coming up more now that people are talking about anxiety or talking about mental health and trying to get the help for it now? What's happening in this, I would say, past 2 years that we're seeing a rise in people acknowledging their mental health and doing something about it?
I think we've been seeing a lot of mental health outbreaks. So
when you say outbreaks, explain.
Outbreaks, just, throughout the world, we're seeing a lot more violence or, cries for help, suicide, a lot of underlying issues that have not been addressed or not had a platform to, be talked about or discussed. So I think there's a desire to want to cure, a lot of the underlying issues. And in order to start the conversation, you gotta start somewhere. Start the education piece. So
I love it.
And I know social media gets a bad rap, but I think social media has been really helpful in that because you have people who are talking about their experiences with depression or their experiences with anxiety, or you see someone who looks like you talking about how they've struggled with, I get really nervous all the time and I don't really understand why it is, and you come to the realization of, oh, it's not just me, or oh, I'm not just crazy, or oh, I'm not just sad all the time and I need to get over it.
Right.
There's other people dealing with these things and there's a name for it, and I can actually go somewhere and get help for it. And that goes back to having resources that you can have access to, community mental health centers, which have not always been a thing, which are now instituted for folks who do have some sort of financial barriers to access and care.
Right. I agree with that. So if we talk about just those of us that are in this room right now, what has been your experience with anxiety or mental health for what you are comfortable with sharing?
Well, I can say after I had my son, I had preeclampsia, which is just like a off key of like your blood pressure, and it spikes, and we couldn't get it under control. But what I learned with my doctor is I'm moving, I'm doing this, I'm doing that. I got a lot going on, and anxiety and stress can play like a huge part in your health. So in speaking with him and starting me on blood pressure medicine, we weren't able to get my blood pressure at a good balance. So he said, well, maybe we need to put you on something for anxiety to calm you down, because if we calm you down, maybe it'll help, calm your blood pressure down and get you back to a good balance. So we tried that, and I've actually felt like the calmness instead of like moving here, moving there, thinking about this, thinking about that.
More aligned.
It's helped me.
Help you be more aligned. Mm-hmm. Were you ever against the meds? Because I know sometimes people will immediately jump to that, and it's like, well, let's try to find an alternative solution, says the person without the degree.
Sure. My philosophy has always been, and this is my spiritual perception, God puts doctors here for a healing hand, for understanding in medicine and ways, to mix science to make a solution. So we can't just, say, well, we can go to the doctor and get the advice, but not
then go home and just pray about it.
And just pray about it, And I know culturally that's what we've done, but I feel like God has His hand in the pot, so He puts situations, people, and science together to help us with what we need. So for me, it's been a lifesaver because I have that balance, and I don't feel like it's something that I would need long term. Mm-hmm. But if I find myself in a situation, like I know my triggers, I get extremely tired, I get overwhelmed, or like she mentioned, I may start having, severe headaches or whatever my triggers are. I feel like I have an understanding of what they are. So if there's ever a need for me to go out to reach out, whether if it's a doctor or a therapist or, someone that can give me advisement on different medicines, I know, there's help for it. You don't have to suffer,
in silence anymore. Right. How long did it take for you to get to the point to be, I would say, I guess, diagnosed, or for your doctor to recommend for you to take some medicine for it? What is that process like?
It's taken me, and I don't want to make this too personal about me. My son will be 3 in October, but after I had my son, I had the 3 back-to-back surgeries, so I was out for a while, which that was very unexpected. And then I had the preeclampsia, and before my son, I never had high blood pressure, high cholesterol, and I got high cholesterol now too. But I was told that, these things may have been hereditary, and they just spiked with you having your son. So I'm like, okay, so what do I do with it now?
Right.
So with trying different medicines, it was just up and down. I still feel away, or I have headaches, or I feel exhausted, and they were like, well, but I do a lot. That's just my nature. Yeah. I'm learning the older I get, like, okay, look, as long as you think you are, you need to calm it down. And even with my husband, like, I pay everything. He doesn't really have to think. And I remember even starting on what they prescribed me, and it calmed me down. And he was telling me something, and I used that as an excuse. I was like, look, now I'm on this medication, and they told me I can't think. So I need you to go and handle that. And then, so he went, and then he came back. He was like, babe, I really need, I was like, you don't like damn near, thinking.
Yeah.
And he don't. He was like, but you're right. But, we had to have a conversation. I need you to take on this, and I had to make adjustments. But yeah, it's worked for me. And I would encourage anybody, if you're having symptoms, there's, help that can support you. It's Absolutely. Not a hush-hush thing. It's not anything wrong with it. It doesn't, devalue who you are as a person or us as a culture. I think we need to come out of the realm of the old school thinking and know that there's science and support that can help you through mostly almost anything.
Yep, absolutely, I agree. So
you said something that I wanted to just point something out. So there's a lot of conversations about postpartum depression for women who biologically have children, and not a lot of conversation about postpartum anxiety.
Yeah.
So if you have recently had a child, and you don't have depressive symptoms, and I'm not diagnosing anybody because I don't know y'all, haven't met y'all, I'm not y'all's therapist, but if you notice things are different and you're like, oh, I can't ever sleep because I'm worried about my child's breathing, or if he's crying and I won't hear him or her, whoever, that may be some postpartum anxiety, which is not a conversation that is had very often.
Never heard of it.
I hadn't heard of it until one of my friends.
I feel like I had that because so when they induced me, I never dilated. So they had to do the emergency C-section. But before they did that, the anesthesiologist, I was telling her, like, I can feel pain on one side of my leg, like my whole body. Like, I can feel the contractions. And it bothered me because I knew they were finna cut an incision in me. So if I can feel this on the side of my body, I feel like I'm gonna feel that cut, and I don't want to go through that. So she said something to me, and it was in the sense of, I hear you, but I'm not focused on that right now. But they were moving me to the operation room. So as I was on the table, and they had the curtain in front of me, and mind you, I had already got the epidural, but I could hear her voice behind me talking about whatever the medicine that they were doing now through the epidural for the incision. And it made me extremely nervous, and I became like super, super, super anxious. And then I started throwing up. But at that point, they had already cut me. And I just felt, they move your organs and all that around. It was very, very, very uncomfortable for me. So after I got stitched up, and, we spent the little 3 days, because that's all they give you in the hospital. They pushed us out, and I got home, and I was having all these complications. So I had to go back. They took my gallbladder out. But I feel like that was something going on with my breathing and me, like, vomiting and all of that. So it just kind of went downhill from things. That. And thereafter, like, I created anxiety. Like,
but it was warranted. It wasn't like you create your experience, because I know you can go through PTSD. I've read about that when having a baby.
And if you think of...
And it sounds like you went through
your story just made me so angry, because it speaks to how doctors don't listen to black women.
And that maternal health, the maternal health issue we're having right now in America.
I'm gonna calm down. Yeah, but
that's another conversation we have to dive into, because it's like you were trying to advocate for yourself and what was happening, and for her to be like, I'm not focused on that right now. I understand there's other working parts going on here, but what I am telling you is. What you need to listen to.
It created an anxiety, even now, because even like with them trying to give me the IV, I had to get a PICC line. So like, I don't know if you know anything about a PICC line. It's up in this part of your forearm,
your upper arm,
but it's like a main artery here, but it can go left real bad. It's like, it was intense, and I don't know. So it's giving me anxiety. Even now when I go, I get real nervous. I got small veins. They say they roll. They can never get it. It brings back
it's an anxiety-stricken situation just based on you describing it to us. I can only imagine. Yeah, you being there. It's not that you said you created. No, you went through a situation that would strike you with anxiety.
My blood pressure was high. They couldn't get it down, and so it was a lot. But in speaking of and that's why I feel like I'm slightly in the clinical aspect of things, but I'm also in healthcare, because I've done support through palliative care. And this is a off topic, but it's kind of on topic. Okay. So I'm gonna say it just to say it. Hospice care. I've worked with individuals with hospice care, because a lot of African American people, we don't understand what like hospice care is, because we've never been educated on it.
Right.
And a lot of times people think of, hospice is this dark, gloomy cloud that comes for death, and we don't want grandmama to do that or such and such. But it's a service that you can have if you have a diagnosis that's not curable. If you have cancer, liver failure, kidney failure, these are things that we can't go in and fix your heart. But we have treatment to where we can help you to where you're not having those symptoms, or you're not suffering. Or if you want to stay at home and your children have to work and take care of their families, they're not stressed out, creating anxiety and depression and all these other diagnoses because they can't manage their lives, their jobs, their families to take care of mama.
Right.
You know, so this is a free service that's covered through Medicare that pays for all of your medical expenses. It pays for your nurse that comes in, your CNA tech that comes in to help you with your bathing, your dressing, your mobility, your walking, whatever you need to be comfortable within your home, and it's free.
Yeah.
When you become 65 or disabled before 65, you've already paid into it. So it's included in your Medicaid benefits. So that's another thing with, especially African American people, we don't know that these services are available to us because nobody educates us on these things. So we end up getting the shorthand and suffering when, you know,
causing ourselves to have anxiety.
And you know what I think is also related to that? So it's not knowing that was an available resource. I think culturally it's this, we take care of our own, but it's also the mistrust of the medical system. Mm-hmm. And so it's like, y'all gonna kill my mama, grandma, auntie, whoever.
That's
no,
my
I'm
mama
gonna take
all
her
the way.
home.
I be like, mama, they just giving you, you know, that doctor look crazy out the eyes.
And it's so hard to break away from that because you still have things that are happening. Before it was the Tuskegee experiment, and people like to talk about the Tuskegee experiment like it was so long ago, but now you look at black women maternal mortality rates and how we're 3 to 4 times more likely to die during childbirth.
And we're supposed to be a first world country. It doesn't seem like it.
And the crazy thing is, there's no socioeconomic protections. Education doesn't protect you. None of these things.
Your job may not even be protected.
Marital status, but like they're like, oh, there's certain risk factors for these different things. But for maternal mortality, there isn't. It's the same across socioeconomic status, education levels, relationship status, all of those things.
I recount my sister's experience giving birth to my nephew. Had my mother not been in the room, basically acting a fool, my sister coded, so like giving birth to so had my mother, she started off, she was just like, something is wrong with her, and you know, Victoria's just, she laid out whatever, but she's like, mama, something is wrong with her, and they're like, oh, okay. My mama was like, look,
come on, mama,
I done said, and you know, you have to, unfortunately, as black people, particularly black women, we have to get to the point where, I mean, if I have to make you uncomfortable
then
for
that's
you
what's
to
gonna
give
happen.
me care, then that's what I'm going to do. And I mean, I saw my family do that through any time anyone was receiving medical care. And, you know, it's just, my mother would love to say, ain't no gonna be no Tuskegee around here.
That's true.
Y'all ain't no healer. You ain't no Henrietta Lacks.
Yeah.
So, I mean, it's just you have to, unfortunately, go into these situations. I mean, not only be a patient, but have to advocate.
Be a doctor.
Because even when I was recently in the hospital, they trying to cut me open and I can't even hold down water. I said, ma'am, I said, you're going to have to stop.
Yeah.
Stop. Because until we address this very ever-present issue, whatever else is there, it can wait.
Yeah.
And so,
you have to
I mean,
advocate
it's
for
just,
yourself.
I firmly believe, I don't know if I could say this, that you speaking to black people's mistrust, there's an anxiety around receiving medical care, period.
Yeah.
I mean, I literally just wrote an article about it. It's strong, it's real, and it's not just Tuskegee. It's not just Henrietta Lack. It's individual experiences as well.
Like what Crystal just described.
Yeah.
My previous doctor, I've been with her for 12 years. Caucasian lady, love her to pieces. But when I was going through what I was going through, she was like, and I kept having like these pressures in my head and headaches. She told me during my last visit with her, because I decided not to go back, that maybe it was something mental. Because like the tests and everything that we've kind of explored, there's nothing there. So to me, or like if I would go in, some days I was emotional because my blood pressure is high, and I could
this after you had your son?
Yeah, this is still after I'm still dealing with everything. And I did have postpartum, because I felt that when I had it. But that subsided, and I know my body, so I know certain triggers. And if I'm depressed, I can say, okay, I'm going through depression, because I know what depression should look like, either in myself or other people. I just feel like, I have that awareness. But she was giving me labels that I didn't have. I did not feel good, and I can't make this stuff up.
So was she just saying like, no, you're crazy, this is all in your mind, it's not happening?
In a professional and humble way. So at that point, and this is me being spiritual again, I had to leave and pray and say, okay, God, well, she was with me for 12 years. Maybe that was her season, you know, and she did an amazing job with everything up until that point. So maybe I need to move along and find something to give me a better solution. Right. And the doctor that I'm with now was like, no, that makes sense. You had surgery on your intestines, and it's all connected to the head. So he started sending me and doing, different tests on my, just different things. And we came down to, okay, well, maybe you have anxiety. And ever since he started me on what he said, I don't even know the name of it, but it's some type of anxiety. It's an antidepressive, but it works for both anxiety and depression. Although I'm not depressed. Right. I'm probably one of the most
on the opposite end of the spectrum of depressed.
But it worked. It's like I've had no issues since then. So,
but that's good for you that you were able to. You knew.
Yeah.
You advocated for yourself and went elsewhere. You didn't just stay and say, well, she said it's mental,
well,
so...
that's what the doctor said.
Yeah, so that's what it is.
And they will give you labels. So, sometimes... And not to say that doctors are wrong.
They practice medicine.
They practice medicine. And they practice that there always has to be a fix to it. And sometimes the fix can be a mental woo-saw. Sometimes it can be medication woo-saw. I didn't feel like mine was mental. I feel like it was something... Even though I guess it's mental with the anxiety, but I feel like it was something bigger than just like, oh, you just stressed, or oh, you're just depressed, because I didn't feel some of those things.
But that even goes to like when you're thinking about you're seeking the care of someone, and basically in cute words she told you it's in your head. Like that, I think that takes away from people seeking mental health services.
It does. It's discouraging.
Because, I know for me, like, my introduction, I love my mother, my parents, they were just amazing. My mother said, just like you can catch a cough, she was like, your brain is an organ. Sometimes it needs a tune-up.
Yeah.
That's true.
So, she was like, just like when you cough and there's something wrong with your lungs or something else, sometimes when you experience this, there's something wrong with your brain. Like, you need to take care of your total person.
Right.
So, I know for me, my introduction to mental health and mental health services wasn't a scary one because of what my parents did.
Right.
But, for them, it was a really crazy entry into a world they knew nothing about. So, I think it's imperative that now that we have all of this information and so much information, even though we can't speak clinically like the two of you, we can maybe find ways to do it plainly or speak about it in plain language.
Like this. Like what we're doing now.
Like what we're doing now.
Don't promote shame.
Right.
I've seen so much of that.
Yeah.
And even like, okay, I'll take an example. One of my classmates from college, he's doing, I guess, I don't remember it exactly, but it's like mental health pop-up shops. He's taking literally mental health to the Black community. He's going to different neighborhoods. He's somewhere in Texas. Different neighborhoods in the city that he's in, and he is providing mental health services.
That's
like
awesome.
on these days, at this time, you can come see somebody.
Yeah. And I think that's necessary. But why do you guys think, did we touch on it? Why is there so much shame still? It's 2019. Why are people still afraid to talk about this stuff?
To say tell somebody you crazy. That's
but you're supposed to say it, but you're not calling yourself crazy.
But just
society doesn't look at it that way.
It's just like the label of crazy or not well is something that follows you.
Okay.
That's not like, she had a cold.
It's gone.
It's gone. I mean, maybe you may have had an issue for a period of time,
but it's like
we haven't been able to normalize
enough where you can come back 5 years from now. You're right. Because 5 years
from now, in that direction, though.
Hopefully,
it is. I really think it is because it's
accepted it.
It's
because she right. You'll come back 5 years from now and be like, y'all remember when Liz said that on that podcast? Oh, she crazy. And
that'll just be like, well, no,
it's not what she said.
I mean, even if she was quote unquote crazy, it may have just been in that moment. Like, remember when Liz was over there coughing? Oh, she had that cold. Doesn't mean I'm always going to have that cold. Right. Doesn't mean I'm always going to have that. So, I mean, I think it's just, we need to take away we need to help address some of the stigma and like seeing, and I think one thing, seeing people who look like us providing these services like you two, that's great because that provides a level of comfort and ease.
It's a safer space.
Because it's like you were saying, it's like, I know, okay, this is a black woman. We may have not had the exact same upbringing, but there are things that are
core fundamentals that she's going to understand.
That are simple constructs of being black women in America that she will understand. So if I say, girl, listen, it won't be a yes. It's a okay. I'm going with you. Yeah. So I mean, I think it's just it's a heavy job.
It is. Y'all. It is, and we have to do it together. And I have a friend who is so dope, and so she started this whole trap therapist movement because it's not just about looking like one another, but the experiences that folks who grow up in urban or low income or underprivileged communities, that's going to be different from someone who maybe grew up middle class or in suburbia, and there's nothing wrong if that's your background, but it just kind of helps to know that like I can show up my full self, quote unquote hood self, and talk to you about I get nervous sometime and I don't know what to call it. And your therapist is like, well, so there's this word, you don't know if you've heard of it, it's called anxiety. This is what it looked like. This is what you're telling me. This kind of lines up. And I think we have to stay clinical. We have to stay informed. We have to stay aware. But in our conversations with clients, I'm an experiential therapist. So like whatever I need to be in the moment, that's who I am. And sometimes that is a very soft, nurturing voice. And sometimes that's look here. This accountability, these boundaries, all these things you said you was gonna do, it's not happening. And I think with our clients, like we need to be able to explain things to them. I feel like part of what you were telling me, like part of the frustrating part of what you were telling me about your experiences is that this woman was not explaining these things to you. Because if she had said, I'm wondering if these symptoms that you're telling me may be something that are psychosomatic, which is...
If she had explored, it sounded like she really didn't explore.
Yeah. Oh, by the way, psychosomatic is like mental health concerns kind of manifesting as physical symptoms. So that's psychosomatic. If she had said, I'm wondering if it's psychosomatic, have you had any of these concerns? Because all doctors have to take some level of like a mental health rotation, even if they don't become like psychiatrists or anything like that. So have a person educate you. So when we talk about education, like we all need to create a space where we're comfortable talking about mental health. But as clinicians, I feel like we have even more of a responsibility that when we're in that moment, we need to be providing education. Like I could say PTSD and, some folks will know what that means, but some folks don't. There's a lot of people that I've had to have conversations with them and they were like, nah, I can't get PTSD. I ain't never been pregnant because they equate PTSD with PDD.
Or
PPD,
or that's PTSD equated with the Army. Like I've never been. That's most times we hear about it, but it's like what you mentioned about the education, and I like the idea of the trap therapist and the gentleman of what he's doing in Texas. Because if you recently saw on Instagram, Charlamagne posted the rapper YG. He got on there and he was like, he didn't know what mental health was, but he was introduced to some director on a set, I believe, and he was just talking to him about, when you have these thoughts, when you do XYZ, that's mental health. And he was like, nobody ever told me that. He was like, oh, so you mean like I ain't got to bottle this up? Like I can talk to somebody about it and feel better? And it was great that he had that acknowledgement and he was getting help. But it was like the comments were crazy of people trying to clown him. Like, you so-and-so age, how you don't know nothing about mental health? Is what you said. If I grew up in a certain environment, I never heard of this stuff. I don't know anything about it. But he was fortunate enough to get around somebody who introduced it to him. But then the world wanted to clown him because he didn't know. It's like, that's what's crazy to me.
That's the accepting piece.
That accepting piece.
That's
But and have the people probably in the comments, they don't even know what mental health
People
is.
love to shame people about things that are not their own issues.
Yeah.
So like,
because your mental health good, you could shame somebody else, or you act like it's good.
Yeah. So
if your mental health was so good, you probably wouldn't be in these comments acting a fool. But carry on.
Like that's the thing. Like we gotta be focused on other people's stuff. Like, oh, well, I am, financially secure. So why are you going out and taking out payday loans? And don't you know that this going to do XYZ thing to your credit? Well, no, because they've never had a financial well-being course.
The interest is you're going to pay that double.
Right.
Nobody's ever told them that.
But nobody's ever told them that. What they were told is that, hey, you got a little bit of a deficit between the 20th and the 30th of the month. You can go up here and get some money. You have to pay on something back, but you'll be able to get your bills paid and take care of your kids. Mm-hmm. But because you're financially secure, you want to focus on other people's issues. Or you feel like, I am emotionally well, I'm going to talk about other people's concerns. Shame ain't never helped nobody get better at nothing. Some folks need to be ashamed of some of the stuff that they do. You out here sexually assaulting people, be ashamed.
Yeah.
Be very ashamed. But there is no shame in what you don't know.
There is no shame, like you said, the example you gave, and I saw Kerry Washington said the same thing, just like we go to the dentist every 6 months to get our teeth looked at. Go get your brain, your mind, whatever you want to call it, looked at. It should be no shame attached to that. That I'm trying to get help to make sure I'm in a great mental space so that I can be the best person for everybody around me and so that I don't show up to work and kill everybody one day, Mm-hmm. So it's definitely no shame in that.
So stop shaming people. Like, if we can just, even if you don't educate anybody, even if you don't talk to nobody about therapy, you are doing the world a whole lot more good if you just don't shame people on some shit. Because I can't stand for folks to get enlightened and now everybody who don't know what you just learned 3 weeks ago need to read a book. Well, my nigga, all you did was read a Google page. So let's talk about
Let's talk about that. It's like, if you're going to be in that space, I feel like those kind of people, if I go and learn something, I'm all about sharing it with my other people. Like, y'all, I just learned what this word was. Let me tell y'all. So now y'all know, y'all can go forward and tell somebody else, Mm-hmm. It's all about sharing the wealth and sharing the knowledge and education and not shaming people. I can never get jiggy. I know it's the old word. I can never get jiggy with that.
Oldie but a goodie.
So, go ahead.
Can I say 3 things?
You can.
I've been adding them up with y'all conversation. So, you mentioned PTSD. Mm-hmm. So this is an example of when I say like everyone has a certain level of mental health. So I was rear-ended in the back of me, but I saw the car like coming, and he didn't stop. So after that accident, when I would drive, especially when I would hit that street, because that's like my routine going home, like I would get so nervous, like looking through my mirrors, and then like if a person gets too close, I'm like, ooh, please don't hit me.
Yeah.
So that to me was my PTSD.
Right.
Eventually, I got over it. So for me, it was acute. It was short term. It didn't last forever. But that's like an example of like we all go through like some of the same issues and feelings and symptoms. Aside of that, when we were talking about people don't have the education pieces, I hear all the time that people are like, oh, well, grandmama forgetful. She don't know. Or like my mom. My mom takes care of her elder brother who was born with cerebral palsy. He's mentally retarded and he's deaf. And like now he's 77. He got a little dementia kicking in. We don't know like the true education behind some of the diagnosis. So the family be like, oh, he just forgetful. Or I find my mama like repeating or yelling or getting frustrated. And I'm like, Mama, you know this though. He getting older. You have to take a level of responsibility and understanding what his needs are. Like they're changing because he's getting older.
Right.
So I think, if people are vocal and saying, okay, well, I have depression, or it's a lot of people nowadays that are coming up with bipolar symptoms, if they express it to people that's within their circle, they don't give the education behind it.
Right.
So when people know like what their symptoms or like what's going on with them, they understand it. so we can like keep the education flowing.
Yeah.
So it's like important to like pass the information piece along if there's something that you're dealing with, you know, regardless if it's a diagnosis or not, but to just research as much education as you can and to continue to educate those around you. That way we can all, you know, gather information and knowledge together.
I love that. Continuous
My mama
education.
be straight yelling. And then he deaf. I be like, Mama, what?
He can't hear you.
He can't hear. Like, he good at reading lips, but she gets so frustrated. And I would think a woman of like her intelligence and her age, because she been doing this forever. And then sometimes like he revert back to like childish ways. And it's like, why are you like allowing him to
upset you?
But it's not just her. It may be parents who have children that have developmental issues. Mm-hmm. They go to the doctor and the doctor say, okay, well your child is ADD, you know, or ADHD, or you know, they have these symptoms and issues, and the mom may not fully know, and when he's jumping off the couch and, you know, all of that, she like, you better sit your ass down before I beat your ass.
Yeah.
And it's like, okay, mama, but we talked about this.
No,
it ain't about beating his ass. It's about,
because he's still gonna jump across that couch.
You know, if the kid is autistic, you know, we don't. Well, I can't say we don't, but I see a lot of cases where people don't have a full education to fully support that person in their need.
Yeah.
So,
and we don't have the resources. And I think part of that frustration too is like, I feel overwhelmed and I don't know what to do, and I've tried all I know to do, and so my last resort is, okay, I'm gonna beat your ass, because that's what I was told.
That's all I know.
That's what I know.
That's what I know.
The Caucasian physicians don't know how to communicate it to us, or they don't give us.
They don't take the
pieces
time.
Of knowledge.
They don't take the time.
They rush in, rush out. They give us, you know, and we don't do our research, and we don't have anybody to follow up to tell us,
to
like,
show
okay,
us like what should I be
researching. This is the breakdown of what this was gonna look like, and this is how you should, you know.
Like this is what ADHD looks like. So you know if he is jumping across the room, this is why. It's like these are the markers for it. This is how you can get help. So you're right, the resources, because it has to be continuous, because if that stays with the child, as they get older, like with your mom's brother, it's going to change. As their life cycle changes, the behavior's going to change. And you can't be, you know, and then you turn into, at 13, at that point, y'all boxing. Because you've been trying to beat his ass, and now he's so hyped. Yeah, so y'all just about to box.
He's just looking, because he can't.
And then, you know, so.
Her blood pressure up now.
Yeah, and it gets us nowhere.
It gets us nowhere.
At all. Today's Living Single question is, did Cassie really win? And we're talking about the singer Cassie, who was more famously known for being the girlfriend of Diddy. So I recently did a poll on Instagram, and the vote was really split. You know, more people than not said that she didn't win over those that think that she did. And I say we really only know if she won depending on what Cassie actually wanted. You know, did she want the money and the fame that came with Diddy and half of the love on the outside looking in? Or what appears to be love? I'm not sure if it is yet, because we're just looking at pictures, and a child. It really just depends on what Cassie wanted. But I think the more important lesson here is knowing what you want before you enter a courtship or deal with a man or a relationship on any level, so you are clear about your intentions, you make them clear with him, and then move from there by only staying if you are getting what you want and desire, because you're worthy of getting all of that and more. So I don't know if she won or lost, but she looks happy from the pics that she's posting online. And that's my final answer. So continue to send in your Living Single questions on Instagram or Facebook, and we'll be right back. So in talking about resources, and that is something that we absolutely need in the community, that in education, that you have to continuously and consistently be educated. But other than say, well, no, I'm not going to say other than, tell me, who can people go to for help? Who should you not be going to for help with anxiety or mental health issues?
You need to go to a clinician.
Okay. When you say a clinician, does it mean like a psychologist, a psychiatrist, a therapist? Like, what are the clinicians that?
So there are clinical social workers, there are marriage and family therapists, there are professional counselors. Somebody who is master's level trained or better, okay, who understands mental health diagnoses. A lot of psychiatrists can also be your therapy clinician, but a lot of they can do that, but a lot of them primarily do medication management. And so typically what I always suggest is go see a talk therapist before incorporating medication.
Okay.
Sometimes your primary care physician will make a recommendation for a medication, and there's not necessarily anything wrong with that. But I do think if you are going to be on a psychotropic medication, that you should also be receiving some sort of clinical support through talk therapy if you've not already done that.
Mm-hmm.
I know people talk about like the church and the separation between
church and state.
I really hope that if you are a person who attends church, that your church is supportive of you receiving clinical care. There are some churches that have mental health ministries that have master's level trained clinicians who can support you. I don't think most pastors are equipped to be your therapist. They can counsel you through all sorts of other things like spiritual struggles, particularly like relational struggles, things of that nature. But if you think you are dealing with something that might be a diagnosable clinical issue, most pastors don't have a clinical background for that. But I don't think that we need to completely separate those two things, because for a lot of folks, spirituality is the only thing that's been getting them through periods of extreme anxiety or intense depression. So I won't say don't go to your pastor, but maybe your pastor got a great referral resource for you. Mm-hmm. I remember at my church a few weeks ago, there was a young woman, it was Easter Sunday actually, the night before she is contemplating suicide. And she said the only thing that got her through was that she knew she would be at church on Sunday and somebody could help her. And I ran up to the pastor after services like, hey, did y'all connect her with somebody? I'm not practicing right now, but I know some folks. He's like, oh yeah, no, we have a few people within the congregation who support individuals like that. And so use your resources. Don't talk to anybody about your mental health that has already shown you that they are not going to be supportive. I do believe in when people show you who they are, believe them the first time. That's the full quote.
Yes.
The first time. But it's okay. I think it's okay to have a person who is supportive of you sharing your mental health concerns that is also not your therapist. So a friend or a spouse or, whoever that can be like, okay, so did you go to therapy? How's it going for you? What was it like for you? Like, just to have somebody in that space. So it doesn't have to all be professional. I don't think it should be. But know that, like, the diagnosis needs to come from a professional, that any sort of treatment approaches, you need to be informed. You need to be a part of that conversation. Don't just let anybody tell you, oh, well, we gonna do this your diagnosis. Okay, well, how you know that's my diagnosis?
Right.
Tell me. I went to the best dentist I ever had was the one who told me, she was like, well, this is what's happening with your tooth, and this is why I have to do this, and this is going to make sure that it doesn't happen. She educated me.
And I could trust what she was saying.
And she was believable.
Yeah.
So if somebody tells you that you have anxiety, have them tell you why. It's like when you go to a restaurant, y'all don't eat McDonald's because I know y'all don't. But when we used to go to McDonald's and we ain't really trust what they were saying, and so we're like, can you repeat my order back to me?
Yeah.
Sis, repeat my diagnosis back to me.
Yeah.
Oh, I have anxiety. Tell me how you figured that out about me. Well, you said that you were having night sweats. You told me that you couldn't sleep. You told me that your mind was racing. You told me that it's hard to focus at work. You told me it's impacting your relationship with your partner. Those are things that are typically indicative of anxiety. You're like, oh, okay, that's what anxiety is. If they can't tell you that, get a second opinion.
I believe it. And I want to say, I know with this information about anxiety and where you can go in order to get the help, I know Liz and Crystal kind of told us about it, but for you, Casnor and Kyla, what has your experience been with any experiences with anxiety or mental health that you want to share? And like, how did you go about figuring that out?
Well, I said we're not supposed to self-diagnose, so I won't start off with that.
Okay.
But I have run into different situations, which now after this conversation, I look at it more as just PTSD. Because like your situation with the car rear-ending you, I hit a deer on the interstate. So now anytime I'm on the interstate, I'm looking for them.
Yeah.
Anytime it starts getting dark and I can't see as good, and I'm like, okay, Lord, please just get me there.
Yeah.
Because they could be anywhere at this point. So it's certain situations that I notice and I feel the increase in my heart rate. I feel, the tingling in my hands, just different situations. But I've also not self-diagnosed myself as being socially awkward. In social situations, I get nervous. Am I going to say something embarrassing? Am I going to say something stupid? So when I have an invite to those social situations, I get that nervousness. Okay, what do I wear? I got to make sure I'm looking cute because I know so and so gonna be on point.
Yeah.
I got to make sure I fit in with the crowd. Like, so it's different. Yeah, this one. I gotta make sure I got on heels.
Hello.
So she don't tower over
My baby
like,
her laying flat.
Right.
Do
Like
10 crunches real quick so your
right,
abs will show
right.
right.
And then you got the
Don't
nice
eat
glow.
no carbs
You need
for
that
48
glow.
hours. All of that.
See, so situations like that, like it puts that heightened level of anxiety on me. But I ain't self-diagnosed or nothing.
Not even like that.
I love how she was
But I ain't
like, we don't
self-diagnosed
self-diagnose. These are my symptoms. But I ain't,
Yeah.
I ain't
But it's
diagnosing
good.
myself.
I think it's great that you have an awareness of it to try to work through it. I think that's the best thing. Even if we don't diagnose ourselves, we kind of know what triggers are and what certain things bring us up. Because I know for me at work, I operate the Virgo and type A personality in me. People know I don't do anything really that's random. Like, I'm a very structured person by nature. And so when even at work, when I start work at 7, when people send me an IM before 7:30, like, literally that tingling goes through my body. That's when I know. I don't know if it's anxiety or what it is, but that's my trigger. I feel this tingle that goes through my body. And
I'm gonna set her in my
yeah,
7:28.
it's like now I can text people that early, but it's something about I just got to work. What in the hell do you want at 7:09? Like, I just got here. You just got here. What do you want? And every time
You been on their mind all night.
they've been waiting on me to get online.
Anxiety.
Soon as that green pop up.
They had anxiety, so they was waiting on me to get online. You know, that is one thing. Or if I am telling you, I literally had a situation the other day with a coworker where I'm very organized at work. So if I'm coming to you with a resolution for a problem that we have, I promise you I've taken my time. I'm one of those people that I'm going to read as much as I can, try to figure out myself before I ask somebody else what the question is, because I figure most times we can kind of figure it out. So at work, I'm very thorough in that way. So I had to send something to a coworker telling her, like, this is the resolution. This is the final answer. It's no other alternatives. And she kept trying to push back on me. And it literally got to the point where we were emailing, and then I ended up jumping into my IM instant messenger, like, girl, stop emailing me. And you know, you send stuff like that, and you're like, I know I shouldn't send this, but she is pissing me off. Like, I have my trigger has gone up. So I don't, with I ain't gonna diagnose it as anxiety. My worry or my frustration that I sometimes think that somebody that's not a clinician will probably tell me it's anxiety, because the way I just get.
Sound like anger.
It might be anger.
Rage.
It might be anger.
Might be a little bit of control.
It's control. That's what it is. It might be a little anger mixed, a little control, but that control. So when I cannot control a situation, person, place, thing, and I'm learning that because I've learned over time, even with certain situations, I would say in the past 5 years, I might have went on with certain family members. I would always try to jump in and be, Captain Save them. I'm going to take care of it no matter what it is. Mm-hmm. And I have done so great with that over the years that I no longer try to solve my family members' problems. Like, I'm here to help as much as I can, but I'm not going to be an emotional mule and take this on for you. Oh, I cannot solve this for you. I cannot do it. So I've done great with that, but it's still other areas of my life that if I don't have control, like I can't stop you from IMing me that early. I can't stop you from challenging me, but I feel like what I said is right. I know it's right. You might not trust me as much as I trust me, but in this moment, you pissing me off because you're not allowing me to control this situation. So I think that's where mine comes from. And I just try to be aware of it, and I just try to breathe and walk away. Like this morning, and this is kind of like a segue. I had a situation. So I was telling them I had an accident. Big Red is no more. I had an accident. Somebody hit me. So, yeah. So I had an accident recently, and I did not know this. So somebody told me that when you have an accident in Tennessee, they'll like put your number in this dialer for people to call you, like compensation lawyers. God. And so I woke up and I got an email, not a work email, personal related.
What, 7:30?
I don't know what time it was. I think I looked at it. Look, before 7:30, but the email kind of irritated me. And then I started getting these calls, and mind you, I'm waiting for these insurance companies to call me. It's the only reason I'm answering unknown numbers. And at first, the first call I answered, I'm like, I'm not hurt. I'm fine. Hang up. Second call. Third call. I'm like, hold on. Wait a minute. So this one I'm, declining. Yeah, who sent y'all? So that was like triggering. And then I get online for work and something happens. So I stopped my first break. I was like, let me sage this house. Let me go sit down and say some intentions and ground myself. And I've had a great rest of the day. So I've learned like that's one of my coping skills. But just in thinking about that, that's how I navigating the fold. So yeah, control. I need to acknowledge that. I'm still working on it because I can't control the world. I wish I could.
And I'm not diagnosing you.
Yeah, please don't.
I'm not, girl.
Oh, please
not,
do.
We are not in the clinical setting. We're not saying me, but the motivation for anxiety is different for different people. And so for some people, it's fear of the future, and that causes anxiety for me. It's me being subjected to the choices that are made for me by other people, and that causes anxiety. And it could be control. It could be a lot of different things.
I don't know where they deer it.
How fast you going behind me? You know, all of those things. And so the motivations for that can be very different.
Yeah.
And so that's not to say that you have anxiety, but control for some people manifests as anxiety, and it looks like I'm frustrated and I'm angry and I'm asking myself all these questions. Why are you talking to me? Why don't you leave me alone? Why don't you understand that I know what's going on? And then the next thing you know, you put yourself into a 15-minute tailspin about how they got you fucked up.
That's exactly what it is. Well, Amanda was like, these niggas got me fucked up.
But I would
That's
say
exactly what it is.
My experience with anxiety was very new. And so I'm sure y'all have heard the phrase, the devil you know is better than the devil you don't. And so my mental health struggle has primarily historically been depression. Okay. And not major depression, but definitely depression that was more high functioning. And so I was a person that I would always get the things done. So the grades were fine. I would go to work. I would do what my mom would ask me. And then after all the boxes were checked, I'm closing myself into my room. I don't want to interact with the world. I just want to be left alone. I would sleep for like 9 and 10 hours a night. People don't remember me from high school because they were like, Casanova, we never saw you. I know, because I was at home sleep from 6 p.m. to 7 a.m. the next morning.
Trying to sleep your life away the rest of it.
Right. And so what I have found is that I have dealt with depression for so long, that's what I knew. And it comes in waves for me. Working in the space that I'm in with so many students who have so many mental health concerns and so many folks who are dealing with anxiety, and I was inundated with that day in, day out. So we're a new department, and so I don't know if y'all have ever started anything new, but everything clamors onto you. And I was seeing somewhere between 12 and 14 students a day for 30 minutes, and they're telling me that I feel really, high strung, my anxiety's through the roof, and they're telling me all their symptoms day in and day out. And I started to feel anxiety. And so I would sit there and I'm literally trying to control my own breathing and listen to this student so that I can refer them to the right resource, and trying to control my breath because I'm like, I think I'm on the verge of a panic attack. And then I was like, I don't feel like I can really
help these people.
I don't feel like I can really help them, and I don't feel like I can help myself because I'm like, I'm not supposed to be feeling this stuff. And so it was situational. It was a new department. We were completely stressed out. We were seeing way too many students. Now we see a max of 10 students a day, and most of the time it's 8, which is about half a day of clinical work and half a day of administrative stuff, which is a lot more manageable. But we were overwhelmed. And so I was pissed when I started having experiences with anxiety. I was like, no, depression is my girl. This is what I deal with. This anxiety stuff is not me. And I felt really frustrated because I was like, I can't get this under control. But that's not how mental health works. It's not just like, oh, I know the things to do, so I should just be able to do them and be fine.
So that leads me to ask you, and this is another question, what are some coping mechanisms that people need to have in place or can have in place to help with anxiety?
And I think so there's different things, right?
So give some examples of people that may be listening and need help with how can I possibly cope with this?
So meditation works really great for some people. Yoga is really good. So anything that can externalize that. So deep breathing. For me, it was physical activity. I lost 12 pounds while I was trying to figure out what was going on with my body because I was like, I got to get this energy out of me. So definitely therapy. Perhaps that may mean working with a psychiatrist, but also do some non-clinical, more holistic things. So do some affirmations, do some deep breathing, take some time to meditate, medication may be part of it, but take some time to meditate, do some yoga, just get that nervous energy out is what a lot of people call it. Get those things out of your body so that they're not sitting within you. Because if you continue to maintain those things, it's like interest. It's
you just continue to manifest it in your body. It's just a dangerous cycle. What do you think, Crystal? What are some things that people may be able to do to cope?
I think every person is different, and people have to, figure out what their coping mechanisms are and what works well for them. Like some of our residents and patients, like they like the color, some people like soft music. Some people, even me, my supervisor, we had I guess you can call it like a powwow, and I had to like write out certain things that like bothered me. Although I didn't express it to them, but it was therapeutic for me to be able to like write it down. And so some people, write certain things. I mean, every person is different. Like you said, you sage, it could be a therapeutic,
And it's kind of like saging, and it's kind of like the meditation. When I go and I say my affirmations, meditation looks different for different people,
And some people stress eat a lot.
Yeah, unfortunately, when I get stressed, I'm grateful. I don't have an appetite. My appetite goes away, so
And some people have the opposite.
So
people are
everything.
different. It depends on the person, their situation, and what they need.
What they need. So if you do suffer from anxiety, tell me, if you had to say maybe like in 3 steps, I have been to, or I think I suffer from anxiety. What's like 3 steps I should do to try to get help or figure it out? If you had to like break it down.
Can I mention, you asked, a few minutes ago, like what are like the tools and resources that people can reach out to. So as she mentioned, most insurances now have a plan. So if you don't know like where to go or who to call, on the back of your insurance card should be like your 1-800 number to whomever carries your insurance. You can always call and ask, do you have a behavioral health benefit? And if so, they can send you a listing of different, agencies, therapists, counselors, social workers, whatever that looks like. Just like if you were new to an area and you needed to get a new primary care doctor, they can send you a listing of the doctor in your area.
Or you can go on on your healthcare website.
The website as well. Lots of people do websites. And I know finances, you mentioned, was also a barrier. Being that it just now got linked in with healthcare insurance, but if someone doesn't have insurance and or if they're on a healthcare plan that does not offer a behavioral health insurance plan, you can still go to most mental health facilities, and they can do what's called like a sliding scale fee or some type of like low, arrangement.
Like economic base?
Yeah, economic base. Sometimes they go off of income base.
So there are different things to accommodate you, whether you have the insurance or you don't, or if your income is different. So say once you take that step and you have gone, you've called and got the therapist, so should they call and get an appointment and just kind of take it from there?
Whatever your step is. Sometimes you can pop up, if you got the energy and time, go, scout it out. You can sit down, look at the environment. You can call, email, whatever that looks like. But if you feel that you need to talk to someone, I highly, encourage you to do so. There's so many options. There's programs, and most professionals that are in the profession, they want to help. They realize, it's a need for the field. So in most situations, they'll work with whoever. And some places do free counseling.
So it's a matter of just looking into it. Once you get to the place where you feel like, I have these symptoms, I have these triggers, all the things that we've talked about, and I think I might have anxiety, or I just want to find out. Let me take this first step to do my research, whether it be through insurance or not, or Google is our friend. Social media is our friend. It's all ways to find out how to get that help, whether you are, financially have it, or even if you don't have the funds. There are things out there.
And if you know someone who's been to a therapist, ask them who their therapist is, and if they enjoy working with that person, you can go see them. Telehealth is also booming right now.
Okay.
And so for our students who are on the student health insurance plan, they can do, some insurances include free telehealth for XYZ number of sessions.
And tell the listeners what's telehealth.
So telehealth is basically phone therapy or video conferencing therapy. And so for some people, it's really challenging to leave your home and go to a space and know that you're going to therapy. That can be really overwhelming.
Because it's not, people have to understand that therapy and getting help no longer has to be laying on a couch telling your story. Most times it's not like that anyway. No. So now you can do it from the comfort of your home. They have talk therapy. You could text message and do it. the video conferencing. It's like whatever it is that is most comfortable for you, it's probably something out there to accommodate. You just have to do your research. So what would you say in these situations, you know, if you find that you suffer from anxiety, you've gotten diagnosed, you're starting to get help, whatever that looks like for you, and your partner is dismissive of it?
You need to dismiss them.
Yeah.
You got to do what's best for you. Right. So if you are realizing, and you know, you're at a point in your life where you realize something is off balance, or even if it's on balance, but you feel like you need a little bit more support, oversight, you know, do you. Take care of you. Follow whatever steps that's going to make you whole, happy. You know, you only got one life to live. And if you don't take care of you, it ain't nobody that,
nobody else will.
Or can.
You're right. Nobody can.
Health can be life or death. And so we talk about like physical illnesses that we know if somebody doesn't support you on. Like if somebody were to come to you and say, oh, I have, you know, stage 1 cancer and my partner just doesn't seem to really care, we would tell them with the quickness, hey,
go, leave.
Let that joker go. Your health is in a place where you need support and they don't support that.
Right.
They got to go.
It's like it's an uproar if it's like even though mental health is medical, it's an uproar if it's a cancer or a sickness that society deems as normal.
It's
physical versus mental. It's like, girl, you'll be all right.
Just being with anybody who doesn't have your best interest in mind.
Yep.
Bye.
Yeah.
It makes me think of Michelle Williams and her fiance. And so I don't know if y'all watched any of their show.
I saw some clips on Instagram.
Did not. I saw some. We all saw the clips.
So
this is the thing. You ain't never got to watch no show, but you can see the whole
clips,
show.
Yeah.
And I'm really proud of her for making that decision to not continue that relationship, because for him to nitpick about her mental health when they're having an argument, that if that were to continue, that would have been an abusive relationship.
Yeah.
Because this woman has struggled with depression and you know that.
Yeah.
And you are supposed to be her partner in life. And when she becomes upset, you're like, oh, is this your, mental health acting
like making a mockery of it.
That's
like the guy who I dated and I told him I was going to therapy and he was like, that shit don't work. Yeah. Blank stare.
Yeah.
All right.
So,
Like, bye. What you say?
Bye.
So yeah, you have to make sure that you are in a supportive place. If somebody's being dismissive of it, I think that's grounds for dismissal. Absolutely. Mm-hmm. So what if your partner suffers from anxiety? How can you support them in a positive way?
So I think it's different for how you find out that information. So if it's something that you both become aware of during the relationship, I think you definitely have to encourage them to get professional support, whether that is through counseling or some other like holistic resources. Make sure that is a no-fly zone. So like when you having an argument and you talk about, well, you know what? That's why nobody on your job like you. That's different from, that's why you crazy, right? Yeah. Like, make that a no-go. Like, we don't talk about your mental health. That's not we don't deliver those kinds of low blows.
It's not ammunition.
No, never, ever, 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 ever. And what I will say is also, as a person who maybe has a mental health diagnosis, don't use that as a crutch for your behavior in your relationship. To do bullshit and be like, it's my anxiety. No, that's not cool. We're not doing that. Because I think that's how we get to this place where you have these people who are doing these mass shootings, particularly white people who are doing these mass shootings, and the media wants to say, oh, he's had mental health struggles. And so now people think that all people with mental health struggles are out here being mass shooters. And that's not what's happening. Not how it goes. That is not what's happening at all. What I will say is mental health is different for different people. So you have mild, moderate, severe, for all kinds of things. People who have, if you have an impairment that is related to your mental health, what I would always say is that you have to require, as a condition of the relationship, that you are prioritizing your mental health just like you would if somebody was struggling physically. Mm-hmm. So like if I know that I want us to be together for the long haul and you smoke and you want to be with me, you got to quit smoking. Right. Because what I'm not going to do is lose my man to lung cancer at 50 and be raising our children by myself for the rest of our lives. Right. Just like I know that if you've had a history of suicidal thoughts, well, you need to be meeting with your therapist. And I don't want it to be like did you go to therapy this week? No, it's a different way, a supportive way. But like, you don't get to decide, I don't need it no more. I mean, and there's seasons, or like there are some times where things are, you know, just managed with medication, or they're managed without therapy or medication, and you notice things start to trend back to where, okay, maybe some suicidal thoughts or some depression is coming back up, and I need to go back. You need to always be open to saying, yes, I will resume this care for myself, because if not, it can become codependent and it can become really unhealthy.
Detrimental to the relationship.
Yeah, so you have to prioritize taking care of yourself, and it's not negotiable.
Non-negotiable. I definitely like that. So in closing of the roundtable, this has been a really healthy and awesome and educational episode where we have been able to talk about mental health and anxiety, and I'm so grateful that I've learned a lot. So let's just do a quick roundtable to say, you know, to walk away from this conversation, what is one of the most, it's a lot of important things we've said, but what's one important thing that you want to share in regards to anxiety or about your personal experience that you think can help somebody? And we'll start with you, Liz.
I think, like in all things, we need to make mental health accessible. And I will lean back to the example of what my classmate is doing in Texas. He's literally taking it to where people are. And in doing that also, I mean, it makes it a normal thing, but it also demystifies the process of what therapy is.
Right.
And so I think it's something like, you know, like we love to take a community health screening. Come get your blood pressure and your blood. We'll go to where people are. Mm-hmm. So I think it's important that in this, we need to go to where people are.
And get them the help they need.
And give them the help that they need.
I love that. And I think we need to have more. We have a lot of breast cancer screenings. We have the blood screenings, but we never have mental health screenings. No. So we got to do better. All right, Casanova, what do you think?
Man,
I know it's a lot.
So much. I think probably the biggest takeaway is to surround yourself with support. Mm-hmm. And I hate that this is true for some people. Some people are not going to understand it, and they're not going to support it. And with respect to your mental health, those are not your people. Mm-hmm. Not to say that, you know, your granddaddy who always makes sure you financially straight is not still a person who can be a part of your life and support you.
Right.
Just know that mental health is not a conversation that you have with granddaddy.
Right.
What I have found with my dad and I as we've transitioned through our relationship is that he would notice that there were things that I just wouldn't talk with him about. He was like, why are you not telling me this? I was like, those conversations never go away. That's healthy for me. And he doesn't like that. I said, well, Daddy, I'm not going to talk to you about it until I know that I can get a response that is going to be helpful for me.
Yes.
And slowly but surely, he an old man from Mississippi, so this has been a long time coming. Mm-hmm. He listens, and he doesn't always have an opinion.
Yeah.
And he listens, and he doesn't always, well, I think you should do this.
Yeah.
And so make sure you have support. And that's professional support, and that's personal support. And get you a team of people that are going to encourage you. Like, I text my best friend, like, I'm looking for a therapist now. She's like, okay, I think this is dope, and I'm really proud of you for doing this. Mm-hmm. Have those people just like you have your therapist.
Have your tribe.
Have your tribe. That's it. Have your mental health tribe.
Have your mental health tribe. I love it. Kat, what do you think?
I think the biggest thing is identifying your triggers, knowing what's setting you off, knowing when you're having those symptoms of the increased heart rate, and actually documenting it. Once you actually get to the point where you sit down and talk to someone, you want to be able to lay out everything.
Yeah.
This is what's happening. You don't want to go to your 5th session and bring up, oh yeah, I forgot. And then they like, now I got to re-diagnose everything because this is something new. So jot down what's happening when it's happening. I took up journaling.
Yeah.
I'm going to write down what happened today, how it made me feel, what triggered what, and then I can go back and look over it, and I can see the growth over the years. So
absolutely,
it makes a difference.
I love it. And I think that we have to, in society, we just have to start to lose the stigma around mental health and anxiety and all of the diagnoses that may come from it. I think that we have to get help. We have to help our people, like we said, get your mental health tribe. And we have to communicate. And what I mean by communicate is education. Educating our family, educating our friends. If we decide that we are going to go to therapy, with your tribe, share that you've gone, because it may be somebody who was afraid to speak up about it, or somebody in your family. And also communicate with people in your family. When you notice a shift, if you're a person who is in a space that can handle that, if you notice a shift with a certain person, or maybe you're not hearing from a certain person, or their behaviors aren't the same, or maybe they're angrier than normal, or just different things are showing up, communicate, talk to that person. If you are part of that person's tribe, you may have to be the person to step up if they are not coming to you. So I think that all of these tips will aid us in this conversation around mental health and anxiety. It will be a continuous conversation because the work does not ever stop. So I want to give everybody a round of applause again. Thank you all. Your opinions are always appreciated and valued. And I thank you all for coming on the podcast. And we'll be right back with the Montana Minute. Hi, everybody. I really do hope that you love to be single or not to be. But did you know that you can actually get paid just for listening to this podcast? I know it sounds insane, but it's true. We just discovered this free new app called Podcoin, and it literally pays you to listen to podcasts. So here's how it works. You listen to podcasts and you earn Podcoin while you listen. Then you turn that Podcoin in for gift cards at places like Amazon or Starbucks. Or if you're a good person, you could even donate that Podcoin to charity. The more you listen, the more you earn. So here's what you need to do. Download the app right now on iPhone or Android, and I have a special code for you. Simply use our code to be single or not to be, and you'll get 300 Podcoin just for signing up. And if you listen to enough of us on there, you can get a cappuccino at Starbucks or an Amazon gift card on us. So go ahead and go listen to this podcast or virtually any podcast on Podcoin and sign up with the code to be single or not to be. I swear, it'll change the way you listen to podcasts. For today's Montana Minute, it is my hope that this episode was able to bring you all some education, resources, tools, and techniques, and shed some light on the world of anxiety and mental health. This is a very serious subject matter and one that is detrimental to any and all relationships having a healthy and functioning foundation. So, apply the info where you desire for it to be, and know that this podcast is always a safe starting space for your journey if needed. So now I leave you to decide, per the usual, to be single or not to be. The choice is yours. May the peace be with you. Signing off, Shanna Montana.